NDC, or the National Dental Council, has announced a change in pattern for the NEET MDS exams starting from 2025. So, if you're a NEET MDS aspirant, should you change your pattern of studies? What are the changes they have announced, and how should you overcome them? To answer these questions, we have with us Dr. Himani Joshi from DBMCI. Established in 1996, DBMCI is the oldest medical and dental PG coaching institute in India. DBMCI, along with its e-Gurukul app, has everything that an aspirant requires to crack the two major exams, that is the NEET MDS and the INI-CET. From daily morning motivation to 24-hour doubt solving and genuine past year papers, DBMCI e-Gurukul app is the one-stop solution for all BDS students. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Thank you, Dr. Himani, for joining us today. My first question, and which is in every young dentist who's trying to give the NEET mind, how is the NEET 2025 going to be different from 2024? There is fear that the portion, the syllabus, the pattern of examination is going to change.
So a lot of turmoil has been there in NEET like MBBS segment in 2024, both in NEET UG and in NEET medical PG. Thankfully, the dental PG went on smoothly, but this announcement that the National Medical Council has done, that it will be a sectioned exam from now on. So the whole exam will be divided into 4 sections, and that is the big change that they have announced this year. And it will be all about speed and stamina. All right, you have to be correct and you have to have a good stamina throughout the exam. All right, this is the little bit of change that everybody would have to practice, because till now you could have chilled for like 15-20 minutes in between the exam when you did one lot of reading. Then you could take a small little mental break and come back to those questions which you didn't remember. It's not like that anymore. It's going to be 45 minutes, 50 or 60 questions if they follow the current pattern. And you have to be really quick. And with the same alertness of mind, you have to sit through all the 4 sections. So that is the big change that NEET 2025 we're going to see.
So if I finish section 1, okay, and I've not answered a few questions, so I go through section 2 and 3, is there an opportunity to come back to the first section, or they just lock it in there?
Not at all. It's absolutely locked. You have 45 minutes, do whatever you can, and the sections automatically shift to the next one. So you have no opportunity to come back. So you have those 45 minutes for those many questions. Do the best you can, and 4 times.
Understood. So basically it's like 4 separate papers and 4 separate time zones. So we have to be quick while we are answering our questions. So does this lead to the students having some difference in their study patterns or the study method? Or you ask them to continue the similar pattern they have been following?
They'll have to make slightly more practice, because it just can't be just question and answer. It's also a lot of clinical scenario-based questions nowadays that are being asked. So they'll have to really practice doing this, calculative answering. They'll have to be really quick with the one-liners, really quick in marking the image-based questions, which are like direct, straightforward one-liners. And they will have to save time for the longer questions, which are the clinical scenario-based, which need thinking, which really need application of the theory that they've read. So they need more practice of doing those questions. It's not just about knowing the theory. It'll also be about, finishing that in the right time.
Understood. So is there any effective strategy which they can apply so that they learn in this given pattern, they're able to calculate and finish the entire section-wise based on 45 minutes? Any effective strategies you would like to suggest?
Dr. Satish, I think broadly, you have to be a really hardworking and disciplined student. But if you really ask me to point out strategies, I would say 5 things. All right, the first would be, do not mug up. Understand. It's no longer an exam of mugging up the answers. It is about understanding and answering. So that's the first point. Second would be practice clinical scenarios. Okay, there are a lot of options nowadays in textbooks, in books, in apps, in various platforms where you can practice these clinical scenarios. So that would be the second thing. I mean, put yourself in that situation where the patient is there, you're being given a clinical history, you have an X-ray to, add to your diagnosis, and then you have to answer with a treatment strategy or the next step. So practice these clinical scenarios. That's the second thing I would say. Third would be remember questions are simple. Okay, like we say in clinical world that if you diagnose something rare, you will be rarely correct. Similarly, examiners are looking forward to examine you for basics. So don't think that the most difficult answer is always the correct answer. It could be that it could be a basic. So focus on your basics first. So that's point number 3. Point number 4 would be you should learn to rule out. That is probably the quickest strategy to come to the right answer. Usually we look for the right answer. Rather than that, start with option A. Think whether it could be right or wrong. Rule it in or rule it out. Come to option B, do the same thing. Then you would probably come and get stuck at 2 options. And with practice, you would know that no, these 3 are wrong and this is correct. So that's the fourth thing I would say, that learn to rule out things. And fifth thing, which is, I don't know if it is right or wrong, but it really worked for me. It was learn to leave.
Okay.
As as aspirants, we are really very eager to mark more answers.
Yes.
Whereas if I give you a very simple example, one of my BDS batchmates, who was also my roommate, she was All India rank 2, and I was All India rank 6. We did the same preparation. We used to talk, and we used to prepare together. The only difference probably was she marked 4 answers less than I marked.
Okay.
So this strategy somehow stands true every year. So whenever you are in doubt of more than 3 options, it's okay to leave. Don't try and, touch. Now I have to mark so many questions. Try to judge what is the difficulty level of the paper and learn to leave. So these are the 5 strategies, I would really recommend.
Understood. But there was something you touched upon earlier, that the questions are becoming more clinically oriented. So mugging up won't help. Okay. So are there any suggestions on any specific subjects they need to focus more, or any topics they need to focus more, so that they can make the best use?
So, Dr. Satish, initially it was only the dental clinical subjects that had a lot of clinical questions. But surprisingly, this NEET and this I&I specifically, they've asked clinical scenario-based questions from oral pathology, from public health dentistry, from general pathology, microbiology. So even the physiology, biochemistry, I mean, I was pleasantly surprised to see even these subjects, which we used to kind of not really give a lot of importance to, even clinical questions are being raised from these subjects. So every like when I teach on DBMCI, we usually see the current pattern and the current trend that is going on, and based on that trend we usually give up a list of topics that are most important in every subject. So I think that's there on the YouTube channel, that's there in most places. So students can take advantage of this and focus more on these most important things first.
Understood. Even your app has something known as most frequently asked questions. So I've
Yeah,
seen
yeah.
a lot of people telling me that has been extremely useful, the DBMCI app with all the frequently asked questions. So if they revise that, that helps them get maybe 2, 3 answers better off. My
Dr.
next,
Satish, 2024, out of 14 questions in oral surgery, 13 were a direct repeat.
oh, great.
Know how much the previous year questions from the app can help you.
Yes. So now that gets me to my next question. There are 2 things here. You're telling the previous questions are repeated. Okay. So hence answering a lot of question papers, keep solving them would help.
Yeah.
Plus, since now it is a time-based situation where you're 45 minutes, you have to finish one section, move on to the second section as well. So do you think solving question and answers continuously, repeatedly helps? Number one. Second, how frequently it should be done? So from the day one when they're starting NEET preparation, should they be answering questions? Or it should be towards the end? How do you would advise them to go about it? Before you listen to the answer to that question, if you're liking this video, do not forget to hit the like button below. And if you want to take your career to the next level, then don't forget to subscribe to our channel, because it shows the algorithm that you like such content and keeps showing you more of them. So what are you waiting for? Subscribe.
It's a very good question actually, because students usually wait for their syllabus to get over and then I would take the test. That's the general understanding among students, and that's the general trend. But I would really advise that start doing questions from the first week of your preparation.
Okay.
Fix a day, like fix a Sunday or something. If you're an intern, Sunday is the day you have for yourself, right? So fix a day. Every week, they should take a test. Either it should be a subject wise test or a whole syllabus test, maybe a monthly full syllabus test and a weekly subject wise test, because ultimately, they are not going to evaluate you on the basis of your theory knowledge. They're going to evaluate based on that test, right? So it's
Yes.
just like Usain Bolt being the fastest man on earth, not because he knows the theory of running, because he's actually run that race millions of times more than anybody else in the world. So run that race. Take those tests. I think the other part of your question was how frequently. So weekly is the best strategy. And once a month, even if you've not read the full syllabus, take the test. So you know where you stand and you know how much you want to get better.
Understood. So it give you a rough idea of where you are and what you need to learn on, work, focus
People
on.
usually get scared of competition. I'm not prepared. Why should I take the test? My scores will be low. I will be depressed. You can think of it in the other way around also, okay, that it's a practice. Today I have a score of 200. Maybe in the next test, my score is 250 out of 960. So I'm getting better. So you can look at, the tests in this way also, getting better than yourself. That should be the strategy.
Understood. Now there are a lot of people who think I will study on my own. Okay, I can manage this on my own. There are maybe 1 in 1,000 people who have done it. What is your advice or your take about having a coaching and going through it, or trying to study on your own?
Um, Students who study on their own, if they have a very clear vision of, what it is going to be and how exactly it is, and they have help, it's not a bad idea. But since things are changing too fast, there are a lot of apps that will give you a lot of content. There are a lot of books that will give you a lot of content. There are a lot of colleagues who will give you a lot of ideas. Ki, yaar, tune ye nahi kiya, you haven't done this, you haven't done that. Plus, during the preparation, there are a lot of doubts that come up. There are a lot of, oh, why is this book saying that this is the answer and that book saying that is the answer for the same question? So I think for all these things to, keep your studies streamlined and keep you on the track, I think an academy is a good option. It's always a good option to join some one place so that, they guide you on what is needed and what is not. It's an ocean. I mean, even one subject is an ocean. So you have to dive into 19 oceans and choose the best out of that. So that's where the academy probably helps you in, choosing what is guiding you, what is needed and what is not. Also, they help you giving those daily practice tests and weekly tests and grand tests. So that's how they help. They are also very good. Like DBMCI is an excellent doubt solving platform, which is a 24/7 platform where all the 19 faculties come together and the students can post their doubts and they'll solve it within 24 hours. So that's a very big help that students feel. Plus, if I talk about DBMCI, we also try to, handhold our students. Sometimes what happens is they don't want to talk about academics. They feel like, ma'am, it's getting bigger than life. The exam is, it's making me insomniac, or, I have relationship issues, I have problems with my parents, or something like that. There are a lot of things beyond academics also, which crop up during this preparatory year. So since most of these gurus who are the mentors in the academies, they've gone through the same drill. They have been there, they've seen all of that. So they probably are the best people to guide students, how to come out of this situation without wasting a lot of time. So that's how probably the academy will save your time. It'll save a lot of your time. Rather than you learning everything out of your own experience, you save on a lot of time with the academy.
Understood. I always tell them even Virat Kohli to win a World Cup needs a Rahul Dravid. So however great you are, how much talented you are, having coaching, having mentorship always sees that you're on the right path. You might know everything, but why do you want to sit and make all those mistakes yourself when you can easily learn it from others? And how many attempts would you have? 1 or 2, maximum 3. Okay, so you do not want them to go down the drain. So having coaching is nothing to be shameful, but it shows that you're more serious about cracking it and you're not just taking it either side. So it makes real sense. Now that you were telling me there are mentors who guide, okay? So there are situations where students across this 1 year, they feel low, they feel depressed, they feel people who are studying with them are doing better than them. They are not able to give it their whole, or maybe they're giving their whole, they're not scoring enough in those tests. What would be their advice to them during those down phases?
Uh, this is a very common question that a lot of students ask me also. So I just tell them that you should remember one thing. This year is the easiest year of their life from now on. Till 12th, we are really in a cocoon. We are very safe with our parents and everything. Then they've put us into BDS, which is also kind of, it's a graduation. You are having fun. It's not a very big responsibility. This year onwards, you are kind of independent. You have to find your own path. All right. And now onwards, you will have to multitask. Whether you continue your journey as a BDS graduate, starting a clinic, or going to a job, you will have responsibilities. All right. You will have responsibilities of yourself, your health, your career, your parents who are ailing and need health needs. When you're married, you'll have responsibility of your spouse, your kids, some little bit of societal responsibilities. So it will be a big responsibility. This year is the easiest year where you just have to sit, eat, and study. But because of those 19 different subjects coming together, it'll teach you how to multitask. And this year is also going to teach you, how to move ahead in life happily. Every day should be a success story. I don't tell them that don't wait for that NEET result today, which is going to be a happy or a sad day. Every day you can decide, whether it's going to be a happy day, a successful day. Set targets, set small targets. Today I'm going to read 4 hours and I'm going to finish this much syllabus. Do that. The immense amount of happiness that just achieving that small target is going to give you. That's how you would see the next day. Okay, today I did 4 hours. Next day, maybe 4 hours and 10 minutes extra. That little bit of success, that becomes a journey, because world is just going to see that result. It's you who are going to, live that journey. So try to make it the most beautiful phase, and mind you, it is the easiest. Every day in residency, I'm sure you would agree, Dr. Satish, every day in residency is tougher than this beautiful phase of sitting down where the hostel is giving you food or your mom is giving you food and you have to eat and just study. After that, it's going to be a race, career, health, responsibilities. So enjoy this phase. Try to make it a happy one. You will feel better.
Right. That's bang on. I think people who still doubt mentorship, I think it is these talks which you will get access to when you join academies. DBMCI has amazing mentors who would help you down the line, whether it is clinical doubts, whether it is doubts related to how to study, how to answer a given question, and whenever you're down and out, they will help you out. So this is what all mentorship is about. Dr. Imani, before we end, what would be your advice to a young dentist who's watching this right now and aspires to be like you, like how you got a sixth rank All India? Maybe they would want 20th or 25th. They're okay with that. What would be your advice to them?
To advise, dream big. Always dream big. It's not a Martian or a person from Venus who comes and cracks these exams. It's simple, ordinary, average students like you and me. So don't hesitate in dreaming big. And second thing is, there is no shortcut. It's pure, simple, dedicated, disciplined hard work that is going to give you that, and it's not difficult. It's just about making your mind and doing it. So dream big and work hard is what I would really recommend.
There she got me absolutely right on track, because when I was talking about you should be okay with maybe 2025, she's absolutely bang on to tell you should go for the gold. Try getting first, and who knows, you might be the right one there. With the right mentors, the right study techniques, you can easily crack it. We'll be putting all details about how to join a DBMCI course. They have an amazing app. I have gone through it personally, read a lot of content. I wish something was there when I was studying for my MDS exams at that point of time. You guys are lucky it is there right now. So I'm putting all the details in the caption below and in the first comment section. So go and check it out and join today. Thank you, Dr. Himani, for taking us your time out and joining us.
Thank you, Dr. Satish.
If you want to join the DBMCI or the eGurukul app, we are linking down all their details in the caption and in the first comment below. So go and check it out.